You don't have to go so slow.
No.
Mom.
Hi, my name is Crystal Clausen. I'm giving a presentation today on Bezoars. During my clinical rotations in radiology school, I was assigned to a patient that actually had a gastric Bezoar. Her life was on the line because of this condition, so this is what sparked my interest in learning more about Bezoars. Bezoars can be very dangerous to the body if they're not treated or removed in a timely manner. People should be paying more attention to what they're ingesting on a daily basis in order to prevent a Bezoar. After hearing my speech today, I hope that you will all become more aware of what a Bezoar is and how to prevent it, and I hope you have the basic understanding of how to get more information. Much of the information in my presentation today comes from www.mayoclinic.com, and all of my statistics came from www.merckmanuals.com. Does anybody here actually know what a Bezoar is?
No.
Okay, a Bezoar is a tightly packed collection of partially digested or indigestible material that is unable to exit the stomach. These Bezoars can actually completely block your digestive system, causing a severe obstruction, sometimes leading to death, as stated by Dr. Pico from the Mayo Clinic. According to Dr. Neil Kaneshiro of the New York Times Health Issue, Bezoars often occur in patients with abnormal gastric emptying, also in patients that have undergone a gastric surgery. Some interesting facts about Bezoars: they are more likely to develop in children rather than in adults, and they most commonly occur in females aged 10 to 19, and this is all according to Dr. Cohen of the Merck Manuals. Today I'm going to begin by first discussing the types and causes of Bezoars. Second, I will make you aware of the signs and symptoms to look for. Next, we're going to go over the diagnosis. Then I'll talk to you about treatment and prevention options. And finally, the prognosis of Bezoars. Let's go ahead and start with the types and causes. All of my information and images on this visual aid are provided by the Mayo Clinic. First, the phytobezoar in the bottom right here is conglomerations of indigestible food fibers and vegetable matter. They can occur in lots of foods, but the most common: celery, grapes, pumpkin, prunes, persimmons, and raisins. Next is the trichobezoar in the top left. They can weigh several kilograms, and they're composed mainly of hair fibers. The most common is occurring in patients with psychiatric disturbances and those who actually chew and swallow their own hair. Then we have the pharmacobezoar here in the top right. It's concretions of medications that don't properly dissolve in your digestive tract. These are common for those people who are taking several medications over long periods of time, or those who are taking several extended release medications, and more common in the gel caps. And then the fourth main type I'll discuss today is the lactobezoar here in the bottom left. These are composed of undigestible milk curds found in the stomach or anywhere along the digestive tract. They are more common in pediatrics and infants, and according to Dr. Pio of the Mayo Clinic, they can form from high-potency baby formulas. In addition to the causes, the signs and symptoms have also been evaluated. Believe it or not, most Bezoars actually have no symptoms that are presented, but you can have nausea, vomiting, and abdominal pain. The larger Bezoars can cause a lack of appetite, weight loss, and fullness after only eating a small amount of food. Now, in extreme cases, they can cause gastric ulcers, bleeding, obstruction, and that can lead to tissue death or gangrene anywhere along your digestive tract. Let's go ahead and talk about how Bezoars are diagnosed. They can be diagnosed in different ways according to how your healthcare provider wants you to pursue it. Most of the Bezoars are detectable as a large mass lesion, and those are on tests such as the X-ray barium studies, CAT scans, and ultrasounds. They can sometimes be mistaken for tumors, so usually the doctor will request that an upper endoscopy be done. Endoscopy involves looking into the body with a scope. Under endoscopy, there's an unmistakable irregular surface appearance, and they can range in color from yellow-black to gray-black. Now, let's move on to how they are treated and prevented, and all of the treatment information is according to Dr. Kaneshiro. The first thing you want to do is just have some observation. If you're asymptomatic, which means you have no symptoms, you can actually have a Bezoar discovered incidentally during just a regular test that doesn't actually have symptoms of a Bezoar. But these do not actually require any kind of treatment or intervention. According to the 2010 research of the Mayo Clinic, if the patient has symptoms, it can be manually removed via endoscopy. Now, the rock-like concretions and the trichobezoars, the hair bezoars, usually require laparotomy, which is a surgical excision. In minor cases, enzymatic therapy can be done, which is premier supplements to promote premium health of your intestines. Following the treatment is the prognosis. The prognosis is very well. Full recovery is usually expected. Now, however, in extreme cases, like I mentioned before, death can occur. Now that we discussed all the basic knowledge of the Bezoars, I want to recap and close with some interesting facts and information for you. I hope that I have made all of you aware today of what you're ingesting on a daily basis and provided you with some information on how to prevent a Bezoar. Let's go ahead and review. First, I presented you with the 4 main types of the Bezoars here. Second, I went over the diagnosis. Third, we talked about the signs and symptoms. Fourth, I announced treatment and prevention options, and finally stated the prognosis. I only discussed the 4 main types today. I'd like to close with the last type I'm going to discuss, which is the pseudo-Bezoar. It is the least common. Only 1 in every 50 patients is diagnosed with one of this type, and it's composed of either coins, bike chains, or any other metal objects. Now, like I said, 1 in every 50 is diagnosed with this, and that's according to Dr. Cohen. In conclusion, Bezoars are very harmful to your body. As I previously stated, they can even cause death in extreme cases. If you'd like additional information, you can contact www.mayoclinic.com or talk to your healthcare provider. Thank you and have a good day.
But that, how often is that? You take one a day or something?